Hello, greetings everyone. My name is Kimberly Knight and I am here for Orange County Department on Aging and welcoming you here to our World AIDS Day event, International World AIDS Day Awareness Day. So thank you all for joining us. Hello everyone, thank you for commenting in our chat box. You're welcome to put questions and comments in here for our guest panelists today. We are very, very excited to have you here. So please, at this time, we are going to go to our PowerPoint slide and introduce you to our wonderful speakers. So again, thank you for being here today. All right. Here we are, and today's event is presented to you by the Orange County Department on Aging, as well as our LGBTQ plus senior resource team. So we're excited to have you here joining us today. Welcome, meet our speakers. Today you will be hearing words from Mr. Rashard Conrad, who is of the Alliance of AIDS Services Carolina, who is a community partner based here in the Triangle area. And you will also hear from Angel Vick, who's an HIV Awareness Activist, and she's also someone that you'll be hearing a personal story of what it's like to be a senior living with HIV. So first up, we're going to have Rashard, and I'm going to introduce him to you today. I'm very excited about this because he's one of my HIV awareness mentees. And Rashard Conrad is the Assistant Director for Early Intervention Services of the Alliance of AIDS Services Carolina. Very excited to have him here today. And Rashard is currently serving in this position, which is located in Raleigh, North Carolina. He serves as a member of the HIV Prevention and Care Advisory Committee, also with the North Carolina Department of Health and Human Services. He's the founder of Breaking HIV Stigma, an online platform dedicated to providing education surrounding HIV in an effort to end or breaking stigma surrounding HIV. He's also the co-founder of National Black HIV Awareness Day for the city of Wilson, North Carolina. I am very pleased that I'm able to share being a co-founder with him for that day as well. Also, Mr. Conrad comes to us as someone who has served on the UNC ROPE team for the Center of AIDS when it comes to research at UNC Chapel Hill, which is right down the street from us here in Orange County. And I'm very excited to present him here to you today. So, Mr. Rashard, if you mind coming on, I have you here. You can begin speaking. You can unmute.
Okay, thank you so much, Kimberly. So again, I am Rashard Conrad, and I am with the Alliance of AIDS Services Carolina. So we are a nonprofit organization located in Raleigh, North Carolina, where our primary focus is to empower and support our community compassionately and non-judgmentally to improve the health and wellness of those living with HIV and beyond. So here in our office, we do HIV testing. We do it here in the office as well as out in the community. And so our service area, we cover a total of 11 counties, which consist of Orange, Durham, Wake, Chatham County, Franklin, Johnston, Warren, Granville, Person, as well as Vance. And so here what we do, we have, we test for HIV and other STDs and STIs free of charge, as well as out in the community at Johnston County Health Department, the LGBTQ Center of Raleigh, as well as TROSA in Durham. And so a little bit more about our agency. Outside of the testing and education portion, we also do distribute condoms out in the community, as well as we have a food pantry, which is open to the public as well as those who are living with HIV. And so our pantry is open Tuesdays from 1 p.m. until 4:30, and on Wednesdays and Thursdays from 10 a.m. until 1. And so outside of those two services, we also offer counseling for our clients who are living with HIV. And that counseling service is a free service where we just help them to go over and set goals for them to help achieve certain goals within their life. And so I wanted to go over some data as it relates and pertains to HIV, specifically to North Carolina and Orange County. And so in 2019, according to the North Carolina Department of Health and Human Services, there were a total of 1,383 new HIV diagnoses, which were reported amongst adults and adolescents, so those who are over the age of 13. And so this was a slight increase from 2018, where there were 1,201 new diagnoses. And so of that number, in Orange County, there are currently, at the end of 2019, there were 310 total individuals living with HIV. And so in 2019 itself, it looks as though there were 10 new diagnoses that were found living in Orange County, which compared to 2018, there was 11. So that was just one increase from 2018 to 2019 in Orange County. And so of the newly diagnosed for the state of North Carolina, as far as the route of transmission, we're looking at about a 55.7% of the cases were from men who have sex with men, or male-to-male sex. And there was about a 12.6% from heterosexual encounters, so male and female sexual encounters. For the IV drug use, that was about a 3.3% of the cases. And there was a 2.6 combined of men who have sex with men as well as those who use IV drug use. And so there is a 25.9% varying rate of transmission that is unknown, which is why it's very important that we try to ensure that if you are sexually active, that you are getting tested at least once every 3 months, and that you are using proper protection. So I was able to provide and obtain some stats of the number of individuals based on age groups living here in North Carolina. And so for the age group of 50 to 54, at the end of 2019, there were 4,971 individuals who were living with HIV between the ages of 50 and 54. And for the age group of 55 to 59, there were 5,123 individuals who were living with HIV.
For you cut on your camera. I'm sorry to interrupt you, but if you cut on your camera, thank you.
Okay,
there you go. Continue.
All right. And so for individuals who are 60 to 64, there are a total of 3,484 people living with HIV that are in the age range of 60 to 64. And the last age group that we have approximately 3,335 individuals who are living with HIV that are age 65 or older, living in the state of North Carolina as of December 31st of 2019.
Wonderful. Awesome.
Sorry. And so one of the, as far as the testing goes that we do provide, I wanted to just provide a little bit more information. So the testing that we provide here in office or whenever we are out in the community, it is a free and confidential testing. So we do traditional as well as rapid HIV testing. We also test for syphilis, gonorrhea, chlamydia, as well as hepatitis C. And so once we do the testing, we will do a pre-counseling as well as a post-counseling, just to kind of go over, just to ensure that you are educated and have any materials that you need for yourself, whether it's educational or whether it is in the form of condoms, lubrication, dental dams, or anything of that nature, as well as we do have a PrEP referral program that we have in place with Duke Medical Center, to where if a client were to come in and test negative for HIV and they wanted to get onto PrEP, which is the pre-exposure prophylaxis, which is a once-a-day pill to help prevent the contraction of HIV, we're able to help facilitate that. As well as for anyone who does test positive, we're able to help connect those individuals to care, whether it's at Duke or their local health department or somewhere in their local area as well. And we'll also refer out for different services if our clients were to need them. So if they were need housing, mental health services, substance abuse services, or anything of that nature, we're able to refer them out to outside agencies that are able to help with those wraparound services.
Wonderful. Thank you so much for sharing that, Rashard. And we had one question I was going to ask you, because I
Okay.
know you have this piece, and you might have already said it, but the Orange County, the idea of the number of those diagnosed with HIV older than 55.
So no, the information that I was able to obtain was from the North Carolina Department of Health and Human Services 2019 HIV annual report. And their report did not break down by county the age group by county. So I don't have that for the county. I just have the total number of individuals who are living within the state of North Carolina.
Awesome. Wonderful. Well, I'm going to share screen. Did you have any more comments before I share your screen of showing your resources?
No.
Okay, I'm going to show your resources, and I want everyone to take a look at these. Again, Mr. Conrad is over at the Alliance of AIDS Services Carolina, and as he mentioned, they do offer testing and have a food pantry, but I want to make sure that everyone can see this current slide here, where you can be able to reach out to Rashard. And I thank him so much for being here to share. Today is World AIDS Day, so I'm sure it's been a very busy day for you today, working and everything over there. But yeah, so as it has here, you can do testing. Also, if you want to learn more information about the Alliance, I've included their website here, and I also have it on some more resources for everyone to be able to do that. So, yeah.
And Kimberly, I was able to look at the annual report from the Department of Health and Human Services. So I'm not able to provide a breakdown of the number for Orange County specifically. However, if you like, I can break down the number of individuals within Region 6, which is the total of the 11 counties that my agency covers.
Okay, sure. Share with us that total if you like.
Okay, so within the 11 counties, for 2019 of newly diagnosed for ages 55 to 54, there were 1,051 cases for ages 50 to 54. There were 1,089 cases, new diagnoses for individuals 55 to 59. There were 709 cases for individuals who are 60 to 64. And there were 716 cases new cases for individuals who are 65 and older. And again, this is within Region 6 of our regional network of care, which again includes Chatham County, Durham County, Orange County, Wake County, Johnston, Franklin, Granville, Person, Vance, and Warren counties.
Oh, wow. Thank you so much for sharing that. And thank you for sharing that you cover those 11 counties, Orange County being one of those, and bringing the significance of those statistics to us, because it's so much more present when you think about where you actually reside and live and how that affects your age group and the county that you reside in. So that is awesome. Yes, so here in the chat, we have a question. Are there concerns that older adults don't seek a diagnosis and treatment, or is that not so much of an issue?
So I think that it's not so much that older adults don't seek the diagnosis and treatment. I think that the number just varies. It just depends on the risk factors of the individuals. But in my evolution within public health in the HIV field, I have seen older adults who are actively going out and getting tested and seeking treatment. I think that one of the biggest things for our older adults to remember is that if they are out and actively engaging in sexual activities, that they should still use proper protections when they're able to, and to try to get tested as frequently as possible. The recommended time frame is every 3 months if you are sexually active. Just so that you can keep up with your status.
Awesome, wonderful. Well, thank you so much, Mr. Conrad, for sharing with us that great information. And tell us again about where we can go to find more information about your agency.
Okay. So if you would like more information on the Alliance of AIDS Services Carolina, you can visit us on our website, which is www.as-c.org, as well as we are located at 1637 Old Lewisburg Road in Raleigh, North Carolina, area code 27604, and our telephone number that we can be reached is, sorry, give me 1 second, is area code 919-834-2437, and we're open Monday through Friday, generally from 8:30 until 4:30. On Tuesdays, we are here a little bit later until 6. But if we don't answer, you are welcome to leave a voicemail and someone will follow back up with you. And I did want to also mention, with our pantry services, we do have a nutritional service that we built out for our clients who are living with HIV. So if they are living out in one of the rural counties, or if they do have issues with transportation, if they were to contact our office and get in contact with our care and support team, we can have one of our care and support teams who will actually build the box of food from the pantry and go out and personally deliver that. And with COVID, we're doing a porch drop off, but we'll actually deliver the food from the pantry to your home.
That is awesome, Rashard. And now for the food box deliveries that you're doing, is that for your 11 counties, or is it restricted just to Wake County?
That's for the 11 counties.
Okay, wonderful. So great. We had also another question was about, do you see more HIV, based on your work, have you found higher rates in more rural counties or in our more urban counties when it comes to HIV diagnosis?
So That's a tricky question. So you will generally see it in the rural counties just because with the rural counties, they typically lack some of the resources that more of the urban or larger counties have. So once you really start to deal with the rural counties, you start to deal with funding issues when it comes as far as to testing and prevention, as well as sometime with the rural counties, you run into more stigma around HIV. Just because what I found is that when it comes to HIV and the stigma of that, that sometimes the simple stigma of going out to get tested is a lot for some people, and they do not go get tested as much just because of the perceived notion of going to a location that is known for HIV testing, and they don't want to be perceived as having HIV. So that's one of the reasons that our agency will go out and do events inside of the community at places that traditionally don't just view it as strictly HIV testing. So we'll do it at local health departments. We'll do it if there's a community event, we can come out and do testing there. But in the rural counties, you do typically see a higher rate, simply just primarily due to the lack of resources.
Okay, wonderful. Thank you for explaining it, and thank you for these wonderful questions in the comment chat box. I greatly appreciate it. We're going to take just a few more moments to give final questions for Rashard, and then we're moving on to our next panelist, Ms. Angel Vick. Are there any other comments or questions below? Feel free to put them in there, and I can read them out to Mr. Conrad. Again, thank you so much, because I'm so excited that you're here, because we have done so much HIV work together in the past, and I'm very excited that you're a part of this and you have served on many different committees and organizations when it comes to this. So I'm excited to see my mentee continue to grow and blossom, and I wish you all the best in taking on the torch of helping with preventing HIV.
No problem. Thank you so much for all of your help in inviting me to this. And if anyone has any questions, please feel free to reach out to me. You can give me a call at the office at the number that I provided, as well as you can reach out directly to me via email. I'm not sure if that's on the slide, but it's my first and last name, rashard.conrad@aas-c.org. And I'll be happy to answer any questions, or if I don't have the answer, to try to help connect you.
Wonderful. Oh, we have one more question. We also had a comment of great job, Rashard.
Thank you.
Also, our question, I'm curious if there have been an increase in rates throughout long-term care facilities, and are there concentrated efforts to educate residents there?
That's a really good question that I do not have the answer to. However, I do think that that is something that would be worth thinking about and trying to do, because I do know from my previous work before joining the agency here, in my dealings with seeing older members of the community whenever they are in the long-term facilities, or whenever they go to the senior citizen centers, that I do think that there should be a bigger push for the education efforts for those residents, and to provide that in those spaces. So I do think that that's something that I'll try to see if my agency can try to work with, possibly with your agency, to kind of help come up with something so that we can try to tackle that. But I do think that's a good question, and something that we should be trying to work towards finding a resolution for.
Absolutely. Thank you for that comments about that. I know when I was doing some research myself about it back in graduate school, when I was doing preventative focus on PrEP medication, which you mentioned earlier for prevention, we did see an increase in rural communities in Eastern North Carolina of HIV prevalence diagnosis. However, we did not see a lot of education efforts. So I would love the opportunity to work with you to be able to talk more about how that can be for our county here in Orange County, because as we work with our long-term care facilities, we want to increase knowledge base and not exclude that knowledge that could come forth for that. All right. So yes, we have a comment of so proud of my people. Oh, thank you from our mentor, Dr. Allison Matthews. We thank you for joining us today. So we are going to say farewell for now to Rashard. I don't see any other comments coming in, but thank you again so much for joining us. And at this time, we are going to have you go ahead and change over to Miss Angel Vick. We're going to have over to change her. Thank you so much. Thank you, everyone. Thank you, Rashard. Miss Vick, can you undo your camera? Let's see, Miss Angel Vick will be joining us here. And let's see, we can make sure that her camera is on. So Miss Vick. All right, Miss Vick, are you ready? Let's see, you have your camera on. Let me make sure she's ready. All right. One moment. There you go, Miss Vick. We can hear you. Are you ready to undo your camera now for us? You ready? Let's make sure we didn't have any technical issues over there. Please give us one moment, everyone. All right. Let's see. All right, 1 second here, everyone. I'm just going to unshare. Hello. All right, Miss Vick, are you able to undo your camera? Can you hear me?
Can you hear me?
I can hear you clearly. Can you undo the camera?
I mean, it's not letting me, but I don't know. Let's
see. No worries. All right. 1 second. I'm gonna see about how we can help you with that. No, you just had your camera on.
I know, yeah. And then you went off.
Let's see if you can do it now. Let's try it now. Thank you, everyone, for your patience.
No.
Right. I'm not letting you do your camera.
No, but that's all right. I'll just talk.
All right, well, I'm going to pull back up your screen for now. And if your camera is able to come on, we would love to see you.
Yeah, it's not working.
Okay.
It's all right.
So let me know.
Oh, it was just now, Kim. But I saw it and then it went off. It's not, I mean, it was, but it's not now.
Okay, no problem.
It said the video stopped, but that's all right. Just go ahead.
Oh, no problem. Let me see if I can undo it 1 second. We're going to try one more thing, and then if so, then we're going to see if you can open. Okay, let's see now. Okay, try now to see if it will allow you to do it.
Nope, but that's okay. I'm not going to keep.
All right, well, we'll bring up your slide. Thank you again, everyone, for your patience. All right, Miss Vick, you
right now, can you see me?
Oh, there you are. There you are. Stay right there. There you are. Great. We can see you. Awesome. Now you can begin.
Hello, everyone. My name, I can't even see me. Can you see me?
Yep, I can see you.
Oh.
You look great.
Hi, everyone. My name is Angel Vick Lewis, and I am a 59-year-old female living with HIV. I got tested at church back in 2006, and I had came up, well, actually me and my two sons got tested, and one of them came back positive. So we had to go to Johns Hopkins and get the blood test done. And that weekend before that, my son was on his way to go to college. And you could just imagine you getting ready to go to college and you get a result saying that you're positive for HIV. So that weekend before we had to go, I just prayed to God. I just prayed and poured my heart out and was like, God, you know, when we go there, please let him come back negative and, you know, just give it all to me. I can handle it. I've been through everything. He's just getting ready to start his career in football, Rakeem. And long story short, when we got there and we got the blood work and everything done, and the doctor came and said, he has good news and bad news. So I was like, okay, just give me the good news. And he said, well, you know, Rakeem is negative. And I was like, thank you. And he came back and said, but you're positive. And I was like, Lord, thank you. He said, no, Miss Vick, I'm telling you, you're positive for HIV. I said, I don't care, because that weekend I prayed to God and I told him if he would give that to me, that when he goes to school at Central, I would go down there and I would educate all the children young adults that were coming into there. I would learn as much as I can about HIV and AIDS to educate others. So what I did, I just started out, you know, when I was in Maryland, you know, joining different organizations. And the first one that I went to was Sisters for Sisters with Carolyn White and my other sisters. And I didn't even know, but I had went to a event on World AIDS Day where they were given, and I was sitting there, and once I found out what it was, I was like, okay, I'm gonna get up and speak. And this was my very first time speaking. So right at the end of the day, I went up and I asked her, can I speak? And that was my very first time sharing that I was HIV positive. So that went over good. I joined that organization. Then I started, you know, looking around while I was in Maryland for different ones. I ended up joining with PWN Sisters. And I just, you know, tried to educate myself. So, you know, long story short, I moved from Maryland to North Carolina, and I linked up with my cousin Nia Sutton, and she went to Central, and her other, you know, associates that were in Project Safe. So I started my actual HIV advocacy, starting speaking at North Carolina Central. And I spoke every year for Project Safe, and I still do that as to today. And then I joined a couple of other organizations, Healing with Care with the late Dr. Sharon Bynum. And I started off with there. And I just started speaking at different places, joining different organizations, and just trying to, you know, educate myself and help others to understand what it was. But what I learned from Miss Carolyn Hinton is that it was a lot of older people, well, senior citizens, that's what I am, hello. And it was a lot of senior citizens that were HIV positive or were living with AIDS. And that really shocked me, because I think at the time I was maybe 54, 55, and it was people in their 70s and something that had been longtime survivors, and they were positive. And, you know, it really shocked me that it was that many older people that were positive. So anyway, you know, I spoke, I did different, you know, events for people, and I ran across two young ladies that really helped me to get where I am now, and in the different organizations that I'm in as far as HIV and AIDS, Dr. Allison and Kimberly. And they encouraged me to join North Carolina UNCU Cure Cab, which I sit on that board. I'm the co-chair of that. And I've been learning a lot, going to different meetings and stuff, joining a lot of different groups, speaking a lot of places. If I forgot to call anybody out, I'm sorry, I'm nervous. I'm going through something personal right now, but thank you everyone that has helped me to learn more about this. Now, let me tell you, just because you're a senior citizen and you're older, you can catch HIV. And what people need to understand, that you don't die from HIV. You know, you die from the complications of HIV, that which turns into AIDS. So, you know, it's a lot of people that don't want to get tested because they thinking that they'll die or something. And I used to be one of those. I said I would never get tested. I'll just die knowing. But, you know, it's a lot of people that are still being infected because they're not really aware of what it is now for 2020. You know, like it's not nothing like it was back in the 70s or late 80s when AIDS had first came out. And I just you know, I just go and speak and talk to the young and the old, you know.
Thank you so much, Angel. That's wonderful. And again, thank you for that personal shout out to me, because I enjoyed working with you in the community and talking to you and getting to know things about your story and your life. And I really like that piece you just said about seniors can contract HIV, that it does not have an age marker when it comes to it. And I think that's very important here, that we have an aging population that we are working with here at Orange County Department on Aging. And it's important to know that sexual health still matters even in your senior years, that your physical and sexual health does still matter. So thank you so much. Let's see, do we have any comments or questions for Angel? Please put them in the chat box. I would love to see them. Please give us some things. But one question I have for you, Angel, as they're putting in their messages and things in there, and I will also go to the next screen so people can see all the wonderful community efforts that you do, because I know you forgot a few, but that's okay. I got you covered.
Yeah.
I got you covered.
I do what I do. I don't look for what all that other stuff is. I just love helping and, you know, educating from what I've learned. So, you know, it is what it is. But what I do want to say, as far as the senior citizens still contracting. So you just look at it this way. So, you know, everybody knows what a sugar daddy is. So you got the sugar daddy out there. Let's say his name is Mr. John, and he's in the nursing home, and he's the stud of the whole place. So you got Miss Betty on the first floor, Miss Lucy on the second and the third, and he goes and see all of them, you know, having sex. But he's out in the street with the young girls, and he'll contract it and bring it back to the other ladies, you know what I'm saying? So that's how it continues to spread, like, a lot in the senior citizens. And then you it's hard because you tell a senior citizen or older person, a seasoned person, that, you know, you can tell them that they have diabetes, and they're holler, oh Lord, the sugar, or, you know, but, you know, and then you tell them about you know, contracted HIV, and the first thing people think about HIV is that, oh Lord, I'm gonna die. But it's not like that, you know. So everybody needs to just strap up, especially now with this COVID going on. Everybody got to stay together and be bundled up, but you still need to practice safe sex if you're out there.
Yeah, that's a very good point, Angel. And I have a few comments coming on in. Thank you, everyone. We have a question of, thank you so much for sharing your story. I'm wondering, what is the most challenging thing in your daily life living with HIV?
Nothing. Not one thing. My challenging thing is living with diabetes. It's nothing. A pill a day, and that's it. That is it. I don't have any challenges. I remember when I first got positive, I used to tell people I was fine. When I first started sharing, I would tell everybody, you know, I'm HIV. Everybody would break down crying like I'm dying. I stopped sharing, you know, so.
And yeah, and I'm glad you brought up diabetes as well, because people don't think about that sometimes the symptoms or things that affect you with other pre-existing conditions can be worse than your condition with living with HIV.
Exactly.
So glad you brought that up too. All right, chat box, we are going here. Let's see. All right, so, and let's see. Oh, let me scroll back up because you started really commenting there. All right, let's see. Let me go. I don't want to miss anybody. As adults age, inspiration is found through a variety of avenues. What inspiration did you discover after testing positive as an older adult?
Say that again,
What
Kimberly.
It said, what inspiration did you discover after testing positive as an older adult? What inspiration?
Well, I don't consider myself old. It's just a number.
Yeah.
It never really bothered me. I mean, as long as God answered my prayer, I prayed for my son not to be positive. I took on it, you know, as doing the work that I promised him I would do. So every time I do that, you know, that's my inspiration, and, you know, giving back to God, because he gave to me, my son, not to be positive. So that I just do it.
Thank you for that. And yes, that is so important, just to talk about what that was like for you. Oh, I'm sorry. I clicked out of my screen.
And I want to share my shirt, an accomplice of in care. And this is what an HIV advocate looks like.
Oh, I love your shirt. That is very nice.
So I got this shirt because I was going to World AIDS Watch, but the COVID hit, because I want an essay on that. So hopefully I'll get to do it next year. But they gave me, Leah and those guys there, they gave me this shirt, you know. So this is what an advocate looks like.
That's nice. I like that. So, Angel, thanks for sharing your heart and being genuine and sharing your story. I appreciate your energy when I see you. That was a comment from your dear friend, Nashima Darden-Tab.
Hey, Michelle.
Love your spirit, from our lovely Shanae McPherson. And what can all of us who work with senior citizens do to make it easier for older adults to talk about their fears related to HIV?
I would say take the old information from years ago and then take the new information from now, because people are still going by with the old information. They don't really know all the new medicines and technologies that, you know, people living with HIV are having. And it's a lot of people, like, I've been undetected for probably 7, 8, 9 years. And, you know, and being undetected means that I can't pass it on to anyone. And then they have this thing called, what is that? U equals U. So yeah. And by me being positive, and undetected, if I have sexual intercourse with somebody and don't use a condom, I cannot pass it. So, you know, if you educate yourself about this disease and know what the facts are, and not just the fiction of what people think or people say, you know, then you would have no problems of going to get tested. So just like you go get tested for COVID, you still need to be going to get tested for HIV, because right now you would rather be positive for HIV than be positive for COVID or even cancer, for that matter of fact, because it's just a myth. You know, people are not dying. You don't die from HIV.
That's right.
That's the main thing. You do not die from HIV. So if you get tested and they say, oh, you're HIV positive, you just get on your medications and everything and do what you're supposed to do, and you're fine. Do I look like I'm dying? No.
You are thriving and living with HIV, and I thank you for inspiring me, because for many years I've worked and known you. You have always been so inspirational in the community, and I'm so glad that you're an example of wisdom for us that have worked in that type of work in HIV prevention and testing. So thank you. This is so much wisdom you're sharing with us today. And we have a comment of, thank you so much, Angel, for sharing your story and helping to educate others. Thank you so much for sharing your story and being such a light in the community. That was from your fellow panelist, Rashard Conrad.
Thank you. And I like to take this time out to thank my mentor, Dr. Allison Matthews. Thank you so much. Because Kimberly, you remember the first time I spoke at y'all thing? I was so nervous and crying. I had to sing my poem first to get myself together. So Allison, thank you so much. Thank you so very much. And I also like to say thank you to you as well, Kimberly.
You're welcome. You're welcome, Angel. And what a great story, Angel. Continue to let your light shine. That's from our comments here. And I greatly appreciate you. We have another comment, Angel. I appreciate your indomitable, enthusiastic, generous spirit. Yes. I agree with all of the above of those things. Angel is an amazing person, so is Rashard, and both of you being advocates in HIV work is such an amazing thing. I'm so proud of both of you, the work you were doing, and when you were crying up there on stage, I was right with you, right there.
Yes, you would. You and I.
And I understand and respect that, and my work has been for 7 years in that work, so I greatly appreciate those carrying the torch and continuing on. And we are getting ready to close out shortly, but if there are more comments and questions below, please make sure you hit them in our chat box. We would love to hear from you. I am going to share my screen of those community resources I had for you earlier. And these are the resources that we have that are out here in our local communities that you can check out. So it's the North Carolina AIDS Action Network, NCAN, who gave Angel that fabulous shirt. I need one of those. Gave her a fabulous shirt there. Oh dear, it went out again. Let me take it back. There you go. The Alliance of AIDS Services, which you heard from today. Equality NC, homepage for Greater Than AIDS. They're an organization I personally have worked with doing a college tour. North Carolina HIV Training and Education Center over at UNC. And then when it comes to testing, everyone, I want you to feel confident in knowing you can contact the Orange County Health Department as well as your local primary doctor for testing. I always advise, even if you're not sexually active at this time, there's nothing wrong with getting tested and knowing your status. Knowing your status is very powerful.
Yes. Yes.
All right, let's go to the chat box again.
For my UNC Cure Cab and Dr. Nagolis, David Nagolis, and we're doing great things there, and that's what you all got me involved in. So I definitely appreciate that. And due to COVID, we're not out in the community as much. Well, we're nowhere. So, I just want everybody to be mindful. And if you have any questions about it or anything, or need any information and you don't want people to know your business, feel free to hit me up. I'm on Facebook, Angela Vick, and we can talk,
Wonderful. Well, also we have some comments of this was awesome and love the resource sharing. Thank you to Rashard and Angel. We appreciate you. We also have, I just want to say thank you for your openness about this subject. In addition to that, I want to say that my mom passed away back in 1987. I wish that they had available treatment back then as they do now. I miss her so much, and our condolences to that. And we are definitely on World AIDS Day honoring people we have lost due to complications of HIV as well. Thank you for all your work. My younger brother passed with HIV in 1995. We also have thank you for sharing your story, Angel. You are an inspiration. Keep shining and educating others. And thank you so much for inviting Mr. Conrad. Put his email in the chat box if people want his email to reach out to him for resources at the Alliance of AIDS Services. So we are very excited about that. And so I am going to share my screen here. And so everyone, I want to say thank you so much for coming out to our program today. We hope that you all have a wonderful and safe afternoon. As we close out our program, I just wanted to give honor and space to those who are living with, thriving with, and have passed away due to complications of HIV. Because of them, we are here to still keep the torch going and bringing awareness to communities here locally and abroad. So again, please spread the word of great information you heard today. Thank you for supporting the LGBTQ+ Senior Resource Team and the Department on Aging of Orange County for hosting this wonderful event today. We are very appreciative. And as we enter out and exit, if you have any final comments, please put them in below before we exit out. Thank you all so much. I greatly appreciate each of you. And again, have a wonderful evening. Thank you.